It's really important to take care of your mental health because it can affect everything you do, your relationships, your work, your just general sense of well-being. Mental health is your emotional, psychological, and social well-being. It affects the way you relate to other people, the way you cope with stress, and the way you live your life. We all have mental health. Sometimes we feel well, sometimes not so well. Sometimes we actually have a mental health condition. Depending on how you're feeling, there are things that you can do to feel better. So do a mental health self-check every once in a while. Check in on how you're feeling. And if you're not feeling great, check in with your primary care clinician and see if there's something you can do. You know, you may wonder, why do we have mental health problems? Why aren't we all just feeling well all the time? Well, it turns out that our mental health is complex. It is a combination of our biology, our psychology, our social functioning, and our environment. A lot of times we see something like a stressor and we think that's the reason a person is not feeling well mentally. But it's never that stressor. It's a combination of these factors. And it's important for us to pay attention to our mental health because it could really make us have difficulty functioning in the world. We all have mental health, so that means that mental health conditions occur across the board to any group, whether it's an ethnic group or age or sex. They might occur more often in one group or another, or they might appear differently in one group than another. So for instance, in the elderly, the person may just seem withdrawn, quiet, isolated. In kids, they may be irritable. In middle-aged people, they may talk about feeling down and actually say what's on their mind. Whether or not there are specific groups that have higher rates of mental health conditions is still up for grabs. We know that depression happens across the board more often in middle-aged and older people. We know that most mental health conditions start late or early teenage years, so things like bipolar disorder, depression start early in life. But no matter what, anybody across any group might have a mental health condition, so feel free to check in and see how your loved ones are doing. You may wonder how you can tell if someone's struggling with their mental health. Sometimes you can look at them and see that maybe they look tired, maybe they gained or lost weight, maybe they're using substances, maybe their clothes are messy and they're usually very neat. Sometimes you can't just look at a person and see that they may not be feeling well. So the important thing is, if you're concerned about someone, have a conversation, check in with them, and ask them, how are you feeling? When someone's struggling, one of the most important things is support. And really, the way to support someone is to approach them. Ask them how they're feeling. Let them know you're there for them. And don't judge them because they're not feeling badly on purpose. It's the way their brain and their body are functioning. So go to them, ask them, how are you doing? Let them know what you see. You know, I noticed that you haven't been coming to parties lately. You're not coming to school. Your work is slacking. So just start a conversation with them and then you build on that. They'll answer. So the important thing is to listen and don't judge. Sometimes you're going to ask somebody and they're going to say, I'm fine, and you know they're not fine. So go back to them another time. Respect their distance, but go back another time and check in again. That's a way to help someone who's having difficulty connecting to connect. 988 is the Suicide and Crisis Hotline. It's a number you can call, text, or go online to and get immediate help for any kind of mental health or suicidal crisis. Keep in mind, they will put you on hold to connect you with somebody local, but they will be there for you, and research shows it really helps. For more mental health resources, go to cvshealth.com or afsp.org.